Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for Peoria City County Health Department, and welcome to our weekly COVID-19 update. For Thursday, October 14th, the Tri-County to-date total is 53,061 cases. That again is 53,061 cases, which is an increase of 449 over the past week. Peoria's case count over the past week increased by 228 cases, bringing its to-date total to 26,848. Tazewell County increased its weekly numbers by 169 cases, bringing it to date to 20,408. And lastly, Woodford County saw an increase of 52 cases over the past week, bringing it to 5,805. The Tri-County saw an additional 6 deaths over the past week, bringing our to-date total to 823. That included 3 in Peoria County and 3 in Tazewell County. Currently, we have 626 active cases at home and isolating, an additional 23 cases hospitalized. Both of these are decreases from the previous week in our Tri-County area. The 7-day average now for the Tri-County sits at 64 new cases each day within the 3 counties, which is a decrease from 76 from the previous week. Peoria alone is now up to 33 new cases per day, which is slightly above last week when we were at 30 cases per day. In regards to Peoria County, we see that 2/3 of our cases are now under the age of 39, with 16% making up the 0 to 9 age range, another 16% making the 10 to 19 age range, another 16% at the 20 to 29, and finally another 16% from the 30 to 39. So again, those 4 age ranges make our majority of our cases. Regarding our hospitalizations, OSF St. Francis Medical Center and Unity Point Health Central Illinois Methodist Proctor and Pekin are reporting 13 ICU beds in use and 50 non-ICU beds in use. They are not reporting any deaths in the past 24 hours. The 7-day ICU capacity and non-ICU capacity stayed the same since last week. We are now having a daily census of 14 ICU beds in use and 58 non-ICU beds in use. We have a lot of information, especially with the FDA meeting today, but before we go into that discussion, I'd like to bring up Dr. Sater, who is Chief Medical Officer of Unity Point, Central Illinois, to talk not only about what's being seen in the hospitals, but also as we gear into influenza season as well.
Thank you, Monica. And I'll spell my name for the record. It's Samer Sader, S-A-M-E-R, S-A-D-E-R, and I'm the Chief Medical Officer for Unity Point Health Peoria region, which includes Pekin, Proctor, and Methodist hospitals. And today, Monica and the health department was asking, how are we preparing as influenza season is coming and we still have COVID in our communities? And influenza vaccination has been a pillar to reduce hospitalization and mortality within our communities for many years now. It's been mandatory for healthcare workers for quite a while, and this year is no different. The things that I can tell the community is we always look to see what the rate of influenza is going to be and try to predict what the season is going to be like. Last year, due to all the efforts that people put in towards COVID and the number of people that got vaccinated, we had quite a light season for influenza overall. This season is likely to be higher based on what's happening in the southern hemisphere. So we always look to Australia, Brazil, countries that are in the southern hemisphere to get an idea what is our flu season going to be like related to influenza itself. And it's going to be likely higher than last year. And that adds to the emphasis of get your influenza vaccine. All the hospitals are already in full game plan for influenza vaccination. All the staff is getting vaccinated, and we have a deadline for our staff to get vaccinated. And already patients in our offices can receive the vaccine along with all the other pharmacies and the health department. I tell people, get it whatever you're comfortable getting it, whatever is most convenient to get it. For you as a patient, or you as a family member or a community member, everything you do to reduce your risk of being ill is of great benefit, not only to you, but your own household. Anything that is contagious is good to have some protection against. So take advantage of the influenza vaccine. If you have somebody vulnerable in your household, think about them and if they got influenza followed by COVID. It's not fun to have two respiratory illnesses back to back. So think about that as vaccinations are available. Influenza matters quite a bit, and we want to reduce the effects of influenza on our population, and we want to really reduce the number of people that require to be in the hospital. I haven't met many people who enjoy being in the hospital. This is one way to really help reduce those numbers. And Monica, happy to take any questions.
Dr. Sater, you said obviously that the anticipated flu season, from what you've seen in South America, is going to be higher this year than last year. But what about compared to pre-pandemic? Obviously, last year was down a little bit.
It looks like it's going to be an average season, and an average season of influenza does get us a few hundred hospitalizations and gives us a few hundred deaths within the community. The reality is, if we counted influenza very strictly, the number is probably higher than we think. Most people say, well, I've never heard of somebody who died of influenza, or I've heard only one. Usually people who die of influenza, it's on that second problem. So they come in with influenza, they get debilitated, and then they get a secondary pneumonia. And that's what you normally hear. Or they have COPD, the influenza got them, then their COPD kicked in, and then they get in trouble. So I tell people, influenza is like the first hit, and some people die of that first hit. And then we gotta worry about the week 3 and week 4, where yeah, you recovered of your influenza, but now your heart failure, your COPD, that second pneumonia comes and gets you. So you gotta think about it a little longer term.
So if someone gets sick and they're not sure if they have either flu or influenza or COVID symptoms, what do you recommend is the next step they take?
So I think I planted you to ask that question. So the question is, if somebody thinks that they're sick, what should they do? And the first one is go get tested. Remember, we do have treatments for both influenza and for COVID. You have the monoclonal antibodies for COVID, and you have Tamiflu, which is the trade name for medication that if you get it soon enough, it reduces your symptoms and likelihood of having major complications. So go get tested, and we're forgetting about it. So when Monica gives you the numbers of the people who get tested positive, you gotta multiply that by whatever factor we think is out there of people who become symptomatic, get sick, are contagious, but never got tested. So I tell people we still can test more patients. If you have respiratory-like illnesses, go get tested is the main thing you can do. The earlier you do it, the more options for treatments you have.
What would you say to people who might be concerned about getting a flu vaccine on top of a COVID vaccine?
That's a question that I get in my office all the time. And the question is, what happens if I get the COVID vaccine and then I get the influenza vaccine? Our immune system is used to handling many things at once. So for example, you may have a splinter that is getting infected, and then you got a respiratory illness. Your immune system responds to both. If you're uncomfortable, get one week, go get the other one the next week. But in reality, our immune system is built to handle many challenges at once. And I call either the real infection or the vaccine, those are challenges to our immune system, and we're built to handle those. Thank you.
As I mentioned earlier, the FDA meets today and tomorrow, their vaccine review board, to actually look at the booster availability of Moderna and of Johnson & Johnson. So the Pfizer booster has already gone through the full FDA approval, as well as what we term ACIP and the CDC. So that is kind of come and done. Now we're waiting for Moderna and for Johnson & Johnson. Today, the vaccine review board approved Moderna. Tomorrow they will review the data for Johnson & Johnson, but that doesn't mean that our community of healthcare providers, pharmacies, and the health department can start giving it away immediately. It still needs to go through the final FDA approval, and then it will move over to the CDC, where they'll actually give us the guidelines. With this timeline, we expect to have the CDC make recommendations about the boosters for both Moderna and Johnson & Johnson around October 20th and 21st. So operationally, we should look after that to be able to start providing it in our community. So I know people are very excited about seeing the news that will say that unanimously Moderna boosters approved, but it's still step one in a multi-step process. So please, we will communicate with you. Check our website, our Facebook post, your healthcare providers, even your pharmacies. We're all being ready and prepared, but we just need to make sure we go through that final process. With that, I'll open up to questions.
Well, what have you heard anything updating about availability of shots for 12 and under yet?
So the question is availability of shots for individuals 12 and under. So Pfizer has submitted their data to the FDA for 5 through 11-year-olds. The timeline for them to go through the first step, which is that vaccine review board, will actually be on October 26th. So again, following the same timeline, if it goes through the vaccine review board and it's approved, and then the FDA does their final approval, again, it'll jump over to the CDC, go through the ACIP advisory, then to the CDC director's office, and after she makes her final recommendation, the earliest we will see it in our area would be the first week of November, most likely the following week. So November 4th or 5th, we should hopefully have some great news. And I, again, have always shared, I'm personally excited about that because that means my own kiddos can finally get vaccinated.
Regarding the boosters then, even when Moderna and J&J do get their full approval from CDC, is it still just going to be, as far as you know, the certain people that are recommended to get the booster shots, the certain groups?
So in terms of the Moderna and Johnson & Johnson booster and who will be eligible, I think watching what happened with Pfizer is a good key. You know, Pfizer had a different recommendation from the FDA, and then when it went to the CDC, they kind of added some clarifying language. With that in mind, both Moderna and Johnson & Johnson actually approached the FDA using what the CDC had granted Pfizer as a starting point. And today that advisory committee aligned the same criteria that Pfizer was accepted on for Moderna. So hopefully that will move forward with Johnson & Johnson tomorrow, and then we can work through that process. As a provider, that helps us because that means the criteria is the same. So we don't have to be like, oh, which vaccine did you get? And then possibly, okay, then you meet these criteria or you don't meet these criteria. So as long as it stays in that kind of same, that helps us provide consistent messaging as well as being able to answer all those nuances people might have.
I think what I saw on Twitter just shortly before the meeting started is that the Moderna could be recommended at a half dose. Does that pose any problems with administering the shots?
So the question is about whether or not the booster will be a full dose or a half dose. What Moderna provided was a half dose. I think it would not change necessarily our ability to provide it. It does create some planning issues to make sure that we have enough supplies, that we kind of understand what our stocks are of those. But really, you know, once we have that material in hand, and our manufacturers and our distributors, they all understand those nuances. They'll be what we call creating our ancillary kits, which comes stocked with everything we need to be able to deliver that type of vaccination in accordance to that booster. So I think the only difference is making sure that we just recognize when someone comes in, you know, and this is just good knowledge, you want to make sure you have your vaccine card. so that your provider can review it, especially if you're not going to the same provider that you got your original series from. And that way we can walk through and make sure we get you the correct dosing.
I have just a couple more. When you said 2/3 of the cases are 39 and under, did you say correct?
Yes.
Is that 2/3 of the active cases then?
Yes, 2/3 of all active cases,
Okay.
yep.
And then, I guess kind of anecdotally, I mean, how much are people really paying attention to the indoor public masking order from the state, and are we having problems with people kind of backing off of the recommended guidelines?
You know, the question is whether or not how people are kind of working through the indoor masking policy, and it's the challenge of it is the fact that we have individuals that are vaccinated, and it becomes a personal kind of understanding of risk. A lot of times, people also recognize the fact that we don't want to put our employees at risk of having to enforce this. If there is an unruly individual, you know, you come to the health department, you don't have a mask, we repeatedly ask you to put it on. If you become unruly about it, it's quickly try to get the service and get them out the door, because it's not the intent to put our staff into safety issues. Which then kind of poses the other question, which don't make it a safety issue for staff. If you are at a grocery store, if you are at a box store or a small retailer or a restaurant, and they ask you to comply, comply. Be kind to that. You know, I think we've had Greater Peoria Economic Development here talk about, you know, how to be supportive of the staffing volumes at restaurants. Let's also talk about the fact that these individuals are asking to enforce a policy to keep themselves and the other patrons safe. You know, if you really are that offended by being asked by that, then leave the store. But don't become confrontational, and don't make that into an unsafe situation.
With Halloween coming up towards the end of the month, what guidance are you giving for trick-or-treaters or anyone looking to gather around this time?
So the question regarding Halloween coming up and what we should be expecting. So, you know, Halloween poses certain challenges, especially in get-togethers. So if you are indoors at a Halloween party, you know, practicing that same type of distancing, masking, taking all of those considerations into key. Outdoor activities, a lot easier to handle and maneuver. And we saw some of that guidance. You know, we learned a lot in 1 year. I remember last year, a lot of the guidance was keep the candy out on the table. People can walk up and get it. You know, we've learned now, okay, we can pass out candy. We just need to control the flow of individuals, and being outdoors is advantageous. So again, there is great Halloween guidance that the CDC has offered out. And so I highly recommend individuals that are doing trunk or treat or other activities to read through that.
With the booster shots coming up, including Pfizer, Moderna, and J&J, what does that bring the effectiveness rates up to? What number? Do you have any data on that, what the effectiveness rates are?
So I do not have, the question was with the boosters, what does that mean in terms of effectiveness? And if there's any numerical value, is there a change in it? So I think there's a key to understand about effectiveness. Boosters are meant to re-engage your immune system, and I think Dr. Sater, presented it really well, so that you are back to a level where your ability to fight infection or have decreased or be asymptomatic, all of those come into play. If you are only having 2 series right now, it doesn't mean that you are unvaccinated or that you don't have a strong immune response. You do. It's extremely effective. The booster really is to address any type of waning situation. What the vaccines do at this point in time for us, it's giving us time. That's what vaccinations do. They help a community build pockets of protective layers so that the virus searches and searches for a host and then doesn't find one. It makes it more difficult for it. So in terms of the efficacy of it, 2 doses are still very much have a strong efficacy. It's just really trying to re-engage your immune system after 6 months. Some of it has shown almost 8 months needed, but right now what the boosters are recommending is a 6-month period since your last dose.
And I was wondering, with some people, having hesitancy with the COVID-19 vaccine, have we seen any of that kind of, trickle down to some of the normal childhood vaccinations that, children usually get? Have we seen that impact other vaccines, things of that sort?
So the question is, with the COVID-19 hesitancy on vaccines, have we seen it for younger populations? I think there's, we've started seeing before COVID-19 vaccine hesitancy. Part of it was because there was a falsified research paper about a connection with vaccine and other health conditions. That has been disproven numerous times. But I think we see the issue come back and back where there's a lot of layers. One, vaccines are required for entrance into schools. So oftentimes they happen at a very early age, and it's kind of part of the pediatric level. So I don't think we've seen that much change. Where we have seen it is, I think, more people, sadly, not being disconnected from an illness. Much like we've seen uptake in COVID-19 vaccine as more people know people that got COVID. So if you don't know someone that got polio, if you don't know someone that's got measles or mumps, it's so disconnected to you that you don't see the value of it anymore. So even prior to COVID-19, we did see some of that. But the school districts and other required vaccines has always promoted vaccinations, which is a great thing and has helped keep us so healthy and safe as a world. But it is challenging to see that same dilemma. And so I think with COVID-19, we're starting to see the flip side of vaccine hesitancy, which is sadly when more people know of someone, they're likely to get the vaccine. I hope we don't see increased hesitancy on those vaccines such as measles, mumps, polio. The quality of life is immensely decreased when you have that illness, and it's not something we want to re-emerge in our society. Well, thank you, everyone. We will meet again, and hopefully we will have more news to share about expanded vaccine usage. Thank you.